Another great conversation to close out the day with our partner, Medtronic LABS. So I'd like to welcome to the stage Ruchika Singhal, who is the president of Medtronic LABS, and Brent Lautrup-Nielsen, head of global development and advocacy with World Diabetes Foundation. So thank you both. Let's see, you have mics. So we're going to change gears a little bit. We've been talking a lot today about COVID, obviously the global fund, monkeypox, a lot of infectious disease. We haven't talked so much about NCDs, chronic disease, which obviously has been impacted by particularly the COVID pandemic. And so I want to talk and be able to shine a spotlight on partnership. That's another theme of this week, right? Everywhere I've been this week, partnership. So what does that actually look like? And you both have a partnership that you've gone in together that I want to learn a little bit more about. You have Empower Health that started in 2017 in Kenya, launches a multi-stakeholder partnership to address managing chronic disease. Ruchika, can you tell me a little bit about this program?
Sure, happy to. And thanks, Kate. Yeah. And apologies to everyone. I think we're keeping you from drinks. But so Empower Health and Medtronic LABS is really a nonprofit initiative by Medtronic to expand access to healthcare for underserved communities, focusing on diabetes and hypertension. And I think to Professor Agnes's point earlier around you have to get everybody around the table is how we started. And really, and by everybody, I mean at the local level, understanding the public health system, the person working at the lowest level facility in a county, in the district, to all the way at the Ministry of Health at the national level. And that's where we started getting inputs for the design of the program, which is not just digital solutions, but also programmatic implementation on the ground, and starting small and building on it. So not about big ideas. Yes, we had the big vision, which is now coming to fruition together. But really in the early parts, it was working with all of the different, the Kenya Cardiac Society, the Kenya Defeat Diabetes Association, like really 20, 30 some stakeholders. And starting out in a handful of counties in Kenya, building up from there, demonstrating that we can improve outcomes for patients living with these conditions. And then I think as we got everybody to see the program working on the ground, input from everybody on how we can improve it. Now together, we're working with the Ministry of Health to expand that across the whole country. And it's been an amazing learning journey on like what it takes, sort of the nuts and bolts of building partnerships. It sounds good, but you have to sit around the table and be willing to have the hard conversations. Brent, I'll let you add to that because you
so what brought you to this partnership, and what interested you in it, and what have you learned so far?
Well, I think, first of all, thank you for the opportunity to be here. This is a great pleasure. So what brought us to the partnership? Well, I think you asked in the beginning, Kate, what is partnership or what does it take? I think it takes courage. You have to step out of your comfort zone, even though you worked, as we have in the World Diabetes Foundation with the Ministry of Health in Kenya, the same agencies as Medtronic LABS and Ruchika and all in her team. But how do you take that step and actually partner? And when you do that, you have to let go of yourself when you do it. And I think that's the interesting part, well, not all of yourself, but part of yourself that you put into something jointly. I think that is the first step or the big step in most partnership, especially in NCD space, where resources are scarce, ministries are struggling, the epidemiological trend is upwards, and then COVID came on top of it. I mean, we have an obligation, actually. I think the next thing in the partnership is that sense of obligation. This is not a choice. You can do or not do it. This you have to do. I think if Ruchika and I and Medtronic LABS and World Diabetes Foundation hadn't partnered, well, it would have been a failure, or it would have been a lack of complying with what we are supposed to do as international agencies operating in this field. And this has been, I think, the strongest, I would say, encouragement or the powerful element in this, that we came from a track record of experience working in the same area with the same goals, of course with different, you can say, background and perspective, but still with the same goal, supporting a nationwide rollout of a national response to diabetes, hypertension, and NCDs in a country like Kenya, which is a big country and with a growing trend.
So let's talk a little bit about some examples of this and how you coming together and partnering enabled you to do what you couldn't do alone. One thing that you can bring to the table at Medtronic is probably mitigating some risk, right? And thinking through a pilot stage that you can scale. But can you talk a little bit about that and then how you take that and do scale it, and any examples of either challenges you had along the way and how you overcame them, or ways that it really was a powerful duo you bringing you together?
Yeah. I would say you cannot do it without each other. You have to build on top of what's been done. And I think that's where the synergies really matter. Because when we started, Medtronic's been funding the development of the technology platform, and that's great. But if we were just there to monetize that, it's not going to go anywhere. And along the way, people made bets, and other pharma companies, other agencies, like everybody did small parts of it. And so that we were able to take that work further. And it got to a point where, as much as we had been talking, then it made sense. It's like, this is the aspiration. This is our aspiration as well. Now let's build on, you stand on the shoulders of those who come before you. And it's very much like that. I think we really just started in one county in Makweni. And I still remember the first time we're like, how do you do this in the public health system? My experience has been private sector my entire career. And just understanding how the various levels are. And even when we say the government, what does that mean, right? Because it's the health ministry, but then it's also the ICT, it's also community. And you have to bring all of that together as well. And really just building on each other's work is how you amplify the impact. And I think to your point, Ben, around it would be a failure if we don't build on each other's and just try to do our own little things everywhere. We're just never going to solve this huge problem that we have.
Yeah, Matt, you talked about courage, but I imagine it also takes trust. So what were some of the questions or considerations you had when looking for a partner on this, and maybe some advice to others that are looking and pursuing these kinds of partnerships, and what they should be looking for?
Well, thank you, Kate. No, honestly, we're here in New York in the UN General Assembly. We had a high-level meeting on NCDs in 2018. Huge commitment, big declaration, looking at multi-stakeholder engagement, multi-sectoral partnership, all the right words. We had the UN General Assembly in 2019 on UHC, again, even further strengthening that whole commitment from all of us. But who is doing it on ground in the countries? That takes a lot of effort. And you asked me, how could we proceed in Kenya with Medtronic LABS? Well, because we had been there for a long time, Medtronic LABS had been there for a long time. The Kenyan Ministry of Health and other stakeholders, national stakeholders, those Ruchika mentioned, were there. The trust had been built. You can't just do this overnight. It takes that patience, which is another difficult thing in public-private sector partnerships, in government relations and ministerial.
This started 5 years ago, is that right?
Yeah, but both Medtronic LABS and us, we had also had preceding work streams there for a while, and in neighboring countries. So of course, when we then, I would say, discovered or had that conversation and started looking for partnerships, that's when you start to push yourself, which I think is the key. But of course, those global trends that were articulated at the time help you. You have that backing, or you have the legitimacy. But also, as I said in my earlier statement, the obligation. We can't just say this is a choice. That's my key point today. This is not just an option. It's an obligation. And I guess in the UHC endeavor that we're all part of now, and was also mentioned in the earlier panels today, I don't see any other way. How will you achieve universal health coverage by 2030? Primary healthcare, integrated services, community level again. How will you achieve all that without those partnerships? I don't know. I don't know anybody who can give me that answer. Without that trust, without breaking those barriers, and without showing the commitment and aspiration for partnership like this one. And we're just starting, by the way. So let's not take too much, I would say, fame already. But it has the right framework, and it has the right government endorsement and ownership. This is fully governed by the Ministry of Health, National Strategic Plan on NCDs, and of course in the Kenyan UHC 2030 vision. I mean, this is all aligned. So let's not do it. Let's not just sit, Ruchika and I, say, oh, this just happened because we were there. This is a major effort, but I would say it's the only way forward.
And as we mentioned earlier, NCDs obviously were really impacted by COVID, and people couldn't get access to preventative care, couldn't get access to detection, how did having this partnership help navigate what was probably a very tumultuous landscape, and particularly chronic disease and diabetes care?
I mean, I would say when we were managing about 20,000 some patients through COVID, and I mean, our telecounselors were getting calls on food. I mean, forget medicines access, people didn't have food. So just like working with the Ministry of Health to address diabetics need medicine access and just stock out situations, because we're in touch with the patients at the local level. So we know what the situation is on the ground, and just being able to communicate that to the right stakeholders in the government, I think it all helps to build trust during the hard times, to say like, hey, can we connect them to local resources for food? How do we get medicines to those people? And I think that's where you see the power of data in a system like that, and that like you can identify where those spots are. And I think that, I mean, it all just built on top of that. And I think everybody just recognized through this whole process how crucial these types of collaborations are, and how we can help each other, and that it doesn't have to be at odds.
Great. Well, thank you, Bent and Ruchika. I know you'll be here during the reception, so if anyone is interested in talking to you both about this further and about working with Medtronic Labs, encourage you to do so. I will now pass it off back to my colleagues Raj and Michael to close us out, and then we'll see you over some drinks. So thank you.